inspection. You asked if we're going to intubate the patient.
I was over here looking over here. Yeah, they didn't have
so you got to be in tune with what your job is and your job's airway. The other thing is, anytime someone else puts in a tube, what do you need to do? You need to confirm.
What did I ask you to? Did you confirm placement?
What did you find?
I heard it. I heard it.
I'll help guide you.
I'm doctor today.
Okay.
So they're bringing in a 19-year-old that they picked up at home. Y'all got report. Good report. So we're going to take care of the patient.
Hi.
Hello. We got a 19-year-old. He had chest pain and shortness of breath. We started IV, put him on an IV breather at 15 liters, and decompressed him in the heart.
What?
He had paradoxal chest movement, sir.
I did everything so far.
Compressed him. His blood pressure is 152/90.
Sir, are you feeling all right? So you been this quiet the whole time?
Still hard to breathe.
Okay. All right, we're going to get you over on the bed. All right. I'll let you. Can you help me with the patient? Please.
Are you Dr. Smith? We have Dr. Smith here. Do y'all want the bed up?
Why don't we lower the stretcher or raise the bed? Make it a whole lot easier to slide him over. Make sure everything's unattached. Need some help, Jenner.
Do you want to lower the stretchers? It's going to be too high for you?
All right.
You ready?
On count 3. 1, 2.
Okay, so nursing at this point what would your role be?
Assessment.
Okay. Questions that you have for EMS?
And what's the patient's name?
Oh, God. We don't even know his name.
Okay.
Sir, what's your name?
Can you state your name?
John.
Okay, John.
John, what were you doing anything before you got home? Before it got hard to breathe?
Watching a movie.
Watching a movie? Do you have a history of asthma or anything like that?
No.
Okay. Go ahead and start his vitals.
Yeah, we need to get oxygen going.
Yeah. Do you want to get that going?
Okay.
All right, we're going to get you on some oxygen. Did you guys say you had a
non-rebreather?
breather? Already? Yeah. He's already on it.
Yeah.
He's on a non-rebreather.
Pretending.
It's kind of hard with
We're pretending.
Okay, so what you need?
We had him on a non-rebreather, but
Okay, what's... Okay.
imagination.
We're going to go in there with this.
All right, do we know vitals?
All right, we're going to go ahead and get his temperature,
She's
his
getting
pulse
vitals
ox.
right now.
Temperature and pulse ox. I guess.
We didn't get a temperature, but his blood pressure was 152/90.
That's 88%.
88%?
88%.
Okay.
What
What about temperature?
Vitals.
His temperature is 91.4.
91.4? Wow, okay.
Oh, 98.6.
I was going to say he's in hypothermia.
98.6.
98.6.
He didn't have chest rising on the left side.
No chest rising
Yeah,
on the left
that's
side,
all
so
we-
he's probably got a...
Would y'all like to call anybody?
All right, we get his blood pressure. All right, I had to step out for just a minute. I go see another patient, so anything changed while I was gone?
No, we're just getting vitals.
Okay, all right. John, you doing okay? You doing all right, buddy?
Hey, I'm just in a lot of pain.
Okay. Has this ever happened to you before?
No, never.
Never. Okay. All right. Does he have family? Did y'all see any family? No. Did you get
150
it?
over 90. 150 over 90. It come off. This part come off.
Do what? I'm sorry.
150 over 90.
It was 150 over 90?
It will be in just a second, but that's what it is.
Oh, it's unplugged. Sorry.
That's
Gotcha.
sorry.
All right. Y'all get vitals, and I'll be right back to check on you.
Okay.
Let's get his respirations. I guess we can hear his respiration.
and hook up.
They're not color coded.
So, whitey brighty, smoke over fire.
We can take my phone in here.
So the white goes on the right. Patient's right.
Patient's right.
Smoke over fire.
What's going on with me?
We're getting your vital signs. We'll
Respirations are 20.
Sats are 87.
You're going to be able to do pulse on him here? No.
Do y'all bring them in on any oxygen?
He's on non-rebreather.
Okay. So we have a normal breather room, and Sats are at 87 and a normal breather.
Pulse is very rapid. It's 150.
Heart rate's 117.
117. I just got it.
oh,
It's 117. You need to listen to lung fields.
yeah. Did you write down the vitals?
John, how you doing? I don't know if I had told you that.
Still hard to breathe.
So hard to breathe. Are you having any pain right now?
When I breathe,
When you inhale or exhale? Or both?
inhale.
Inhale? Where's your pain? Is it
Left side of my chest.
left side of your chest? So, do the lung fields work?
Yep.
Your lung fields do work?
Sats are still 87% on a normal breather.
We need to call in respiratory. Should have done that a long time ago.
Would you pay respiratory, please? Thank you.
My left side is lung sounds are diminished.
Hello. 19-year-old male patient, complains shortness of breath, diminished lung sounds on left field. Sats are 87% on non-rebreathers.
John, can you rate your pain for me between 1 and 10 that you're
Complains of
having?
left-sided chest pain.
Somebody else looked at our rebreather. Will you check just to make sure
Maybe.
that the bag doesn't work? It's blowing up.
Six.
Okay.
Thank you.
So left side chest pain?
Yes.
What's his history?
He hasn't had any problems like this
He
before.
was sitting at home watching
He was
television.
sitting at home watching TV and started feeling chest pains and shortness of breath.
Try to give him his sats. Sats 87% on
yeah.
the non-rebreather.
What's his blood pressure again?
Blood pressure was 152 over 90.
All right, what was his first, I missed the first part of report. What was his blood pressure initially? When they called your report, did they give you blood pressure?
No, we didn't get a blood pressure when they called report. We got blood pressure when they got here.
So when y'all did you do one?
We tried twice with our blood pressure.
Oh, it wasn't working.
What's this
All right.
again?
87%.
Is there any similar surgery? Any kind of
His heart rate's
protocol?
117.
No.
Lisa?
105.
Watch the television.
That's our 85%.
All right, guys, look, his heart rate has gone up since they picked him up and brought him up, and his stats are going down, so I'm going to call for a chest x-ray to get that. You guys need to try to set him up in the bed. I don't know if this bed's working. It was messed up the other day, but try to see if you can prop him up with something. So let's do that, and I'll be right back. Let me go see if I can't get an x-ray here. Okay.
I got it.
The bed's broke.
Oh, it is?
Yeah. The bed's still broke. Our bed is broke, so we need, I don't know how
We need to sit him up?
Yeah.
We'll just sit him up, right?
Miss Humble, the bed's still broken.
Yeah.
What do you,
We'll simulate that it's sitting up.
Okay. Patient's sitting up. Okay, we're just using this for chest x-ray? Yeah. These degrees has left side.
Woo, they shot our film fast.
Yeah. Yeah.
Hey, Dino, can you spare for just a second?
He's got...
He's got a pneumo. We're going to have to get him ready for a chest tube. Can you grab the chest tube kit for me? And I'll be right back. We'll go get one of the residents and let them put it in. John? John, you got a collapsed lung on your left side, so we're going to have to put a tube in your chest. And we'll give you some pain medicine for that, a little bit of it, okay? But it's going to hurt, but that'll be what makes your breathing better, okay?
Okay.
All right, I'll be right back.
Go ahead and get another blood pressure on him.
All right, guys. We're done.
Oh,
That's it.
that was nerve-wracking.